So today we are privileged to dive into this complex yet fascinating subject and gain a deeper understanding of the mechanisms and clinical implications. It's today my honor to introduce our distinguished speaker, Dr. Budi Wiweko, who's a renowned expert in the field of reproductive medicine. Dr. Budi will be shedding light on the concept of ovarian aging, helping us explore its impact on fertility and how we can approach this challenge in clinical practice. To introduce him formally, Dr. Budi Wiweko finished his post-graduation as an OBGY specialist in 2005. In 2006, he did his fellowship in assisted reproductive technology in Japan and became a full doctor. He became the doctoral program of FMUI Indonesia. He's a professor in obstetrics and gynecology. He's an international affiliate to the RANSCOG. He's received the fellowship of the Indian College of Reproductive Medicine. He's an honorary fellow of RANSCOG. Currently, he is a chairman of the Academic Senate of the Universitas of Indonesia. He's a lecturer staff of OBGY department, FMUI and RSCM. He's the president-elect of the Indonesian Society of OBGY, vice director of Indonesian Medical Education and Research Institute, faculty of Medical Medicine, University of Indonesia. He's a member of the Medical Science Committee, chairman of the National Health Technology Assessment Committee, Ministry of Health, Republic of Indonesia, and he's the chairman of Research Commission of Professors, Faculty of Medicine. Dr. Budi Wiweko, today we really welcome you on this topic, and we were waiting to hear your thoughts on it. Thank you.
Thank you very much, Nandita, for very kind introduction. And good afternoon, everyone, all the speakers, and also General Secretary of AOFOG. We are very pleased to have AOFOG Campus 1. And I will start with the topic, the concept of ovarian aging, as the chairperson mentioned before. So, according to the editorial of the Frontiers in Endocrinology, that right now is ovarian aging is quite sexy because we know that increasing the understanding of ovarian aging is essential in modern world. Why? It is because of most of women have at the age of 30 and then falling to the only 3% at the age of 40 years old. And on the other hand, amenorrhea is a key characteristic of perimenopause and then the aging of the ovary. And we know in time-learned hormone is now accepted as a biomarker for both ovarian activity and also remaining ovarian reserve. The next question is mechanism of ovarian aging in women. How it is happen. In women who are getting older, the quantity, not only the quantity, but also the quality of their follicular oocytes are declined. And this is characterized by decreasing ovarian reserve function, fewer remaining oocytes, and also lower quality oocyte. And the declining oocyte quality is a very principal indicator of ovarian aging. If you look over a few alternation in the ovary with advanced age that contributes to ovarian aging, number one, we know that telomere, the shortening of the telomere is quite important. Decreasing level of telomerase, another telomere-associated protein, decreasing a certain material active in mitochondria metabolism, decreasing of mitochondria DNA copy number around ovulation and cleavage stage, and then mitochondria DNA mutation rate, increasing aneuploidy, protein homeostasis, increasing DNA damage, and then decreasing autophagy functions, and then increasing oxidative stress that ROS will accumulate with diminished antioxidant, with triggering downstream cascade. Age accumulates with might compromise vascularization of the ovary. The process of ovarian aging is not just about oocyte and the granules of cells, but this is also including cellular as well as environmental factors that right now recently is more becoming point of investigations, suggesting that ovarian decay is a complex and a multifaceted process, not only about changing in oocyte quantity and also the quality. So if you look this one, this is the fertility decreases by the age because the declining number of oocytes, number of the follicles in the ovarian reserve, but ovarian functional declining is related to gradual loss of resting follicles and then also reduced ability to produce oocyte competence for fertilization embryo development. It's more related to oocyte quality. And it's likely that ovarian aging depends on multiple intra-ovarian and also extra-ovarian factors such as genetic factors, including chromosome alterations, mitochondria mutation, DNA methylations. This is epigenetics, environmental factors including oxidative stress, and then also potential indicators others such as the inhibin B levels decreasing. So this is as a summary, we can see that ovarian aging also can be induced by environmental factors that inducing from the nutrition factors, epigenetic factors, cellular compartment disturbance, including granular cells, mitochondria, immune cells, reactive oxygen species, tissue compartment. This is the stroma, very important inflammation process, the dynamical of the pyramidal follicles, extracellular matrix, and also we talk a lot about DNA and telomerase. This is a schematic explain why the ovarian aging happen. So if the ovarian aging occur early or are accelerated, they clinically correlates with the premature ovarian insufficiency or POI. And right now, this is the very hard problem in the clinical part as we have our patients, POI patients in the clinics. So this is the schematic of follicular genesis. I think we know, all of us know very well how the follicles undergo atresia during the process, and then many factors intra and extra ovarian will affecting the atresia of the follicles during the follicular genesis, such as like this, the deterioration of chromosome missegregations, meiotic recombination error, spindle assembly checkpoint, DNA damage, telomere shortening, mitochondrial dysfunction, genetic mutation, also ovarian fibrosis and inflammations may be caused by infections. Mitochondria play a role in regulating cellular homeostasis, proliferation or differentiation, and also cell death. Mitochondrial dysfunction is implicated in many age-related pathologies, and evidence support that dysfunction of mitochondria and then declining of mitochondria DNA copy number negatively affect ovarian aging. This is a potential mechanism of ovarian aging. It's mitochondrial dysfunctions, loss of proteostasis, stem cell exhaustions, altered intercellular communications, epigenetics, alteration, cellular senescence, nutritional dysregulations, genomic instability, telomere shortening, and compromised autophagia. If you look the mitochondrial quality for monitoring and ovarian aging, this low expression of mitochondrial fusion 1 and 2 in the outer membrane in aging oocyte will affect mitochondrial fusion and inhibit VTK AKT pathway, so it will affect the oocyte somatic cell communications and then mitochondrial function. And then decreased expression of DRP1 gene in oocyte may affect also mitochondrial functions, leading to decrease in oocyte quality, mitophagy, that mitochondrial autophagy function that will decreases during ovarian aging. Mitochondrial also mediated oocyte apoptosis pathway. This is the influx of the rapid influx of calcium to mitochondria provide high energy in an instance, and but the MDR1 regulate Ross flux from the inner mitochondrial membrane to maintain mitochondrial functions. Then SPD3 may affect the abnormal pairing of chromosome, homologous chromosome. And then oxidative stress and mitochondrial ATP production disorder in aging oocyte may lead to abnormal spindle shape and increased chromosomal errors during meiosis in oocyte. Then if you look, this one mitochondria and meiosis in the oocyte, this is a happen, and there's the problem in aging, and also mitochondria and telomere in oocyte. Shortening the telomere will inducing ovary becoming aging. So if you talk about ovarian aging, systemic metabolism of oocytes, as more women choose to delay childbirth, the declining of fertility associated with age has become a significant concern for modern women. Declining oocyte quality is key indicator of ovarian aging. Many studies suggest that age-related changes in oocyte energy metabolism may impact oocyte quality. So very important, the energy metabolism of oocytes. We know that energy metabolism of oocyte metabolism relies on glucose metabolite provided by cumulus cells. This is the oocyte, this is the cumulus cells. The majority of glucose is metabolized in cumulus cells through anaerobic glycolysis, resulting in lactate productions. And then cumulus cells can convert glucose into pyruvate, lactate, or NADPH. And if something happens, there's some the changes in energy metabolisms will potentially affecting oocyte. TCA cycles declining, phosphorus declining, ATP depletions, lipid disturbance or lipid metabolisms, and also increasing glutamine metabolism. The number of mitochondria in oocyte along with their functions, energy production, and scavenger activity will decline with age progressions. Such multifaceted functions support several processes during oocyte maturations, ranging from energy supply to synthesis of the steroid hormone. Ovarian aging implies the progressive damage of the mitochondrial structure and activities as regard to ovarian germ and the somatic cells. And despite well-characterized role of mitochondria is less known, but how their dynamic energy is modulated by the signaling pathway dependent on pituitary and ovarian axis hormone, then how the latter influence the nucleus mitochondrial toxin crosstalk. This is our study to see how M8 independently affect mitochondrial DNA copy number in the glomerular cells. Depletion of mitochondrial DNA has emerged as a critical factor in women's aging, with decreases 0.4 copy of mitochondrial DNA per year. In addition, the deterioration in mitochondrial DNA decline in MH, the hormone produced by gonadal cells, growing follicles. This data show compare three groups. This one is the copy number between normal weight, overweight, and obese women. Looks that, and also the patients who receive L8 administration and with non-L8 not receive L8, and also patients group who receive growth hormone and then non-receive growth hormones. There is no significantly different in terms of mitochondrial DNA number. But if you look the number of mitochondrial DNA according to the age, increasing the patients getting older, the number of mitochondria DNA is getting lower because this one we see the negative correlations minus 0.54, and then this is also between 8 and MH level. MH is getting lower when the patient's getting older. And then this is the positive correlation between MH level and mitochondria DNA copy. It's showing us that increasing the level of serum MH also increasing the DNA mitochondrial DNA copy number. If you look the number of mitochondria of DNA between the patient getting pregnant and non-pregnant, there is no significant difference. And also, if you look the pregnancy, that will be significantly if the getting lower when the patient getting older. If you look at the concept of ovarian reserve, this is the number of the follicles. This is the ovarian reserve, the patients with the good number of ovarian reserve, the patients with the low number of ovarian reserve. They can have both high AMH or low AMH level. And we can see the patient with high number of ovarian reserve with low AMH level, they will suffering rapid risk of depletions. I think this is the ovarian aging may be getting faster than the patient with the high that has the high level of serum AMH. On the other hand, if the patient has a low number of ovarian oocyte or egg, low ovarian reserve, then the patient have the low AMH. This is become a trouble. The patient with rapidly losing their fertility capability because of rapid reserve depletions. The other promising things are also how the biomaterial and advanced technology trying to evaluate and treat ovarian aging. Later, the second speaker and the third speaker will talk a lot about the current management of ovarian aging and also current evidence of ovarian aging. I just want to see how the biomaterial and technology such as 3D printing and microfluidics for encapsulation follicles and nanoparticle as delivery system for drugs has shown potential to be translational strategy for ovarian aging. This, for example, this is the young ovary, this is the age ovary, so anti-ovarian aging. This is what you can see here, the 3D culture system for improving follicular development and survival, producing more mature oocyte, allowing ovarian cortex grow and survive, the tissue engineering in advanced artificial ovary constructions, enabling the survival and proliferation of isolated ovarian follicles, stem cell delivery, ovarian transplantations, and also parental follicle transplantation. I think this is still, most of them are still in experimental session. So I come to my last slide as a take-home messages. We know that amenorrhea is a key characteristic of the aging of the ovary. And then age-related fertility decline has become a significant concern now, as women right now is many of them postpone their marriage, and age-related changes in oocyte metabolism may impact follicular oocyte, characterized by decreased ovarian reserve, fewer quantity, and lower quality of oocytes. Of course, therefore, with declining ovarian function, and declining oocyte quality is key indicator of ovarian aging. So quality also is quite important instead of quantity. Ovarian aging involves multiple intra-ovarian and extra-ovarian factors, such as progressive damage, mitochondrial structure and activities. This is a complex and multifaceted process. DNA damage, protein homeostasis, oxidative stress, telomere shortening, apoptosis, declining autophagy, and aneuploidy is the risk factor for getting ovarian aging. AMH is a reliable biomarker for ovarian activity and remaining ovarian reserve. Declining AMH level is linked to mitochondrial DNA depletions, showing a direct correlation between ovarian aging and mitochondrial deteriorations. And the last, many innovative technology, including 3D printings, microfluidic, or biomaterials such as tissue engineering and parental follicle transplantations, hold promise for mitigating the effect of ovarian aging. So I'd like to thank all my colleagues in Faculty of Medicine, University of Indonesia. Thank you very much for your kind attention. Thank you.
Thank you, Dr. Budi. That was a wonderful talk. It was very enlightening on this concept of ovarian aging. And really, the work that you've done, your insights, give us a deeper understanding of this crucial aspect. And the way you've gone into the molecular level, into the micro level, I think it was fantastic. And we are so happy to listen to you. I would like to take this. Thank you, Dr. Budi.